Okay, hi there, it's Dr. Buford. We're just getting started on the right knee. We're looking in the central part of the knee. This is where the cruciate ligaments are. We wanted to get a real good idea of the status of the ACL here. We examined your knee before we started, and I couldn't appreciate any pivot shift, which is a specific test, the test for ACL stability. And basically it's a fancy way of saying that your knee didn't seem to be particularly unstable, even under anesthesia. So it's possible maybe you had a partial injury, but there's certainly no stability that I could appreciate. And as we look through here, it looks like this ACL is intact. I'm going to have Mitzi hold the camera. And we're going to basically do a kind of stability test here, just to watch the ligament. But we can see the ligament tightens up there. So there's some ACL there. I just wouldn't want to commit you to a big surgery when we know that the ligament is at least for the most part there and that there's no stability on exam. So now we're going to go ahead and look in the medial, hold the camera for a second. We're going to look in the medial compartment, and I'll take a probe. We're going to examine this medial meniscus very carefully because there was some signal change in the meniscus on the MRI scan. And as we look here, we're going to probe above and below the meniscus. This is above. And so far, things are checking out pretty good. See a little bit of chondrosis here. That's just microscopic. That's really not anything to worry about. And I'm pulling pretty hard. There's really no defects in the meniscus that I can appreciate here. Certainly intact all the way to here. So I think this is checking out okay. We'll go off on the video. I'm going to keep looking here. If there's something else that catches my eye, I'll come back up on the video. Okay, so now we're looking in the lateral compartment. And this is the lateral meniscus right here. Femoral condyle up above. And what we saw here was a little bit of a split in the lateral meniscus right there. And that's why we have the scissors in. We're just trimming that out. But again, not bad. Certainly not as bad as having to reconstruct the ACL. You'll be able to bounce back from this relatively quickly, I would think. Because that's, I think, all we have to do. We'll go ahead and put in our shaver and just flush out the knee. But the rest of this compartment looks pretty good as well. So the next thing we're going to do is we're going to look up at the kneecap, at the patella. And this is actually checking out pretty good as well. Nice and smooth at the top of the screen. The trochlea is this groove the patella slides in. We can follow this all the way down to the front of the knee. And that looks pretty good there. All right, so I'm happy with the way that looks. We're going to finish up here. I am going to take one more look around the entire knee just to make sure there's nothing else going on. But I think we've seen just about everything we need to see. So this is good news. You don't have to reconstruct the ACL. You had a little bit of a tear in the lateral meniscus that we've taken care of. And the medial compartment looks good. The medial meniscus looked good. So good luck to you now. Bye-bye.